And thank you very much to Dr. Samantha for joining us this evening on the show. First of all, we would like to thank you for being in the front line treating the infected COVID-19 patients, and we would like to also tell you that this is a time to be confident and not lose your guard and ensure that Sri Lanka also is on top from all this menace and the crisis that we are facing at present. Now, the first death was reported today. 60-year-old male from Maravilla. Underlying kidney disease has been cited as the cause for the death, doctor, and the reason being is COVID-19. What's happening? A few days ago we thought we are on top, and now back to the gutter.
Exactly. Now by today there are 113 patients has been diagnosed, and there is a one death has happened already. Unfortunately, this is what we wanted to prevent actually, but unfortunately we had to face to the reality. And this patient, if you talk about this patient, he's a 60 years old patient from Maravilla area, and he has been having his diabetes, and he was a patient with kidney transplanted patient, so he has been on his immunosuppressive medications as well. So his immune status also was affected at the time that he got the virus, and therefore with these complications he has gone into the critical phase, and therefore unfortunately he has passed away. But we should make sure that we know about the international figures. It is a fact that most of the deaths has occurred among the patients who were all, like the people who are above 60 years, and also the people with other comorbidities. But we should not forget the fact that there are young patients, there are patients who were not having any diseases also face the consequences. Therefore we must pay our vigilance. We have to adhere to the advices that we have given.
Dr. Samantha, isn't this the time to worry? Because just 2 days ago we thought that Sri Lanka was on top. There was no issue with regard to the number of infected persons. The number was declining, but suddenly there is a rapid increase. We see now from 100 to 113 patients have been infected, with one death being reported. Isn't this time to worry?
It's like this. Now we predicted certain figures. We based on the international the trend that this disease has spreaded in the other countries. We had predictions based on the statistics that were available from the other countries, and it showed that although the number of patients who were diagnosed is less, but actually there can be many other patients who were not diagnosed but are moving in the society. So therefore we wanted to make sure that this social distancing is carried out in an effective manner. Unfortunately, we saw in the previous few days that there were a lot of complications happening. The idea of the curfew is not being carried out properly by the general public. Certain people really must have not understood what is the importance of this curfew, and so on and so on. Therefore, now although we have 113 patients at the moment, we predict that there may be so many other people outside in the society just moving around, and that shows the fact that 3 patients who found, one is from Kandy and other one is from the Kalutara incident. And
the US health authorities has already said that the social distancing guidelines have to come into play up until June, and there needs to be a 21-day lockdown. In Sri Lanka, we are just following the partial lockdown 15 days ago. We're just entering the 16th day tomorrow. Does this mean that after 21 days, Sri Lanka is on the right track? We don't have to worry. Is that what you are inclining, Doctor?
Actually speaking, we should worry. We should worry. Why? Because our health facilities are limited. The number of ICU beds although they say 5% is of the patients are going into the critical phase, the ICU facilities available in Sri Lanka is limited. Our medical, the capacity of the hospitals are limited. So therefore, we should not give any room to spread this disease among the beyond the level of the capacity of the health sector.
But even at this time, Doctor, as we speak, there is political tug of war. You see political parties making statements. We know that there was one time that GMOA also was involved or incriminated with regard to politics. However, right now it's not about politics, it's about making sure that people have a sound healthcare system. The Kotalabal Defence University ICU, there's a lot of talk about the ICU being used to treat those infected by COVID-19. How do you view this, Dr. Samantha?
Like if you take in Sri Lanka, we have around nearly 600 ICU beds available, and we need to increase the capacity, no doubt about it. So therefore, we have taken so many measures to increase the number of beds so that we can provide to the patients who are critically ill. KDU is taken as one of the place because they have a good ICU. I think it's around 30 beds of ICU is available. So therefore, we have requested from KDU, I think it is belongs to the Defence Ministry. We have requested from them the ICU facility to use for the coronavirus patients. I hope that the dialogues are going on, the discussions are going on, how and when should it be acquired. I am sure in near future they will hand over it to the Health Ministry so that we can use it for the ICU patients, and we believe that it is a country's property, not somebody else's property.
So now it's been 3.5 months. Wuhan is going to be open for business on the 8th of April, nearly 3.5 months later. Still, Dr. Samantha, there is no antiviral vaccine against COVID-19.
Yeah.
Why is this? What is the reason behind this? We are so far ahead in technological advancement. We are so far ahead as far as healthcare systems across the globe is concerned, but we still have not been able to find an antiviral drug against this virus.
That is where the technology has failed, I think, because this is a challenge for the new technology. The virus has changed its structure. So therefore, still the scientists are facing the challenge of developing an antiviral drug or the drugs that can be used against this virus. But unfortunately, still the science cannot understand the way of this virus is acting and its structure. So therefore, we hope that it will take few more months if it's to develop something like antiviral.
When you say few more months, when will we see an end to this menace or this crisis?
That is a serious question, and it is very difficult to answer because this contagiousity of this virus is that high. It spreads like nothing, and also the effect is being prevented. Like the prevention of disease is basically based on the behavior of the people. Therefore, it is very difficult to predict the timeline that this virus will stop in this time period. Everything depends on how the general public reacts to this.
Very quickly, Dr. Ananda, before I leave you tonight, you are also a member of the Presidential Task Force fighting COVID-19. The government recently announced a few days ago that, or urged those Sri Lankan passport holders living overseas to remain in those countries and do not return until they are fully recovered or there is an end to this crisis. But this seems to be somewhat of a selfish move. You saw Australia announcing their citizens to return to their nation. We saw the United States announcing their citizens to return back to their nation. And why was such a decision taken by the government?
Actually speaking, it is not a selfish decision. Actually, this is the country. This is the 14 days that we are. This is the time that we are expecting a huge number of patients, and this is the time that Sri Lanka has have to take the every measures, have to take every measures that we can control this virus spreading. Therefore, even this was discussed in the task force. Very positively it was discussed. There is no doubt that we have to accommodate, bring them back to the country because they are our citizens. So there is a very positive dialogues are going on in the presidential task force as well. So I hope in near future with this, when we get this fully control of this disease in our country, I am sure that government will take every steps to bring our citizens back to the country.
One final question, Dr. Samantha. Right now, after this death was announced a short while ago, that was approximately at around 8:50 this evening, Sri Lankans are now worrying. They are scared. What is the message you have for them?
A very simple message. There is nothing to be worried. Stay at home. Do your duty. Staying at home will prevent this disease spreading, and it will protect you and the country as well. So therefore, we humbly request everybody, please stay at home.
Thank you very much, Dr. Samantha Ananda, spokesperson of the Government Medical Officers Association, or the GMOA. He's also a member of the Presidential Task Force fighting COVID-19. We are all in the gutter, but some of us are still looking at the stars. Thank you very much. It's back to a commercial break.